Welcome back to my channel. This is Nasu Mwangi with Fight for Kidneys. Today we'll be talking about type of choosing your dialysis modality. But before we talk about the dialysis modality, let's visit back our last channel. In my last channel, I talked about dialysis access. And let's revisit. What is a dialysis access? Dialysis access is the route or the means of you getting dialysis to clean your blood, to clean your system of toxin and extra fluids. So there are three types of access that you can have. So you can have a catheter that is placed on your chest. You can also, if it's temporarily, you can have one placed on your neck. You can also have one placed on your groin or on your in your femoral area. And then you also can have a fistula and a graft. And those ones are placed on either arm, or they can be placed on your thigh. You also have something called a PD catheter. A PD catheter, it's a catheter that is placed in your abdomen to help in your abdomen, and that's what it's called for the treatment called peritoneal dialysis. So then what are the two types of dialysis? There are two types of dialysis. There's hemodialysis, that's where blood is pulled from your from your body and goes through the machine and get cleaned, and then it's put back in your body. Then there's the peritoneal dialysis. This peritoneal dialysis, your abdominal cavity works as the filtering system. So in your peritoneal cavity or in your abdominal cavity, there are some vessels that are there. So you have these fluids that is put in your abdominal cavity, and then it dwells there, and then after some time, then it pulls. And most people can remember the science, the division, osmosis, the efficiency, and people can remember that. I remember so well when we did the potato, or if you come from Kenya, potato, but how from a place of low solute to the area of high solute. So that's the exchange that takes place with peritoneal dialysis. So those are the two dialysis options that you may have. So on today's channel, I will be looking at that you have been told that you are no longer acute. That means your kidneys, there's no possibility of your kidneys functioning. There could be. Life is so different, we might say it might not regain, and God is great, you may have that kidney functions. That kidney function might regain. But let's say you're that person who have been told that your kidney functions there's no possibility of your kidney functions to regain, that you need dialysis, and you need dialysis to live until you probably get a transplant. So there are things that once you are there, either you're at the hospital or you have been visiting your nephrologist and they have said, hey, you need dialysis. They already told you that you go get an access, and the access has been placed. Probably while you were at the hospital, you did not need dialysis. You did not need that dialysis, but they placed access, and now you have to decide. You're talking with your nephrologist and your care team, and you're deciding what mode of treatment, which type of dialysis do I need to do. So it's two dialysis, but the setting, where would I do my dialysis? That's the things now we're gonna be talking about, the dialysis modality, and where will you be doing it. So the things that you have to ask yourself are your daily schedule. How is your daily schedule? Do you work? Do you go to school? Do you have young children? Do you have people that, are you a caregiver or to somebody else who is sick? So you have to look at those things about your daily schedule for you to be able to determine which treatment modality will work for you. and which dialysis setting will work for you. Then you have to ask you, do you travel a lot? You might have a job that you travel 90%, you travel, or you travel 75% out of a month. Then you have to ask, what type of dialysis will work for me? The other thing you might ask yourself, are you at school and do you work full-time? Do you work part-time? Do you work in the morning? Do you work in the evening? Or do you work at night? You are also social life. Are you that person who it's like you like meeting with people, gathering, talking, what kind of your social life, then your availability of a person to give care to you. So most people, when they need dialysis, sometimes they have to have somebody else helping them. In some instances, not all the time, but in some instances, you might have to have somebody be there with you. So when we think about these things, that's when you sit down and talk with your doctor and say, hey, let's explore my life. And one thing I'll say, for you listening to me, if you are you have been told you need dialysis, you have a parent who have been told need dialysis, you be the provider for that person, or you be living with that person who need dialysis, or it's your child that need dialysis, because we have seen instances where young kids need dialysis, and that that's where the doctors will be talking to you about the treatment options, of which most of the time for young kids, they get that peritoneal dialysis, but some instance they might not be able to do with the PD. They might have to do the hemodialysis. So the best dialysis option is that one that fits your lifestyle. And I always tell people, dialysis treatment should not fit, should fit in your lifestyle, not the other way around. It's not dialysis dictating your life. It's your lifestyle dictating how you do your dialysis treatment and doing it as prescribed. So I want to make that clear, that just because I'm saying that dialysis should fit your lifestyle, it should not be an inconvenience for you, but you have to make sure you still have to do it as prescribed. And remember, just because you're on dialysis, you still have to live a thriving life. I have seen most people, they get to dialysis and they feel like, this is it. I cannot take it. Yes, at the beginning, it's stressful, it's scary, you're afraid, you're worried, you're concerned. But that does not mean you never have a thriving life. You can dictate, you can be your own advocate. So if you have, let's think, generalize, let's think about your lifestyle. And just this one, if I'm saying it, that you still have to talk to your provider. I'm just saying, for you to have things to brainstorm, to think out when, say, if your loved one, or it's you or your loved one who need dialysis, you can say, hey, I heard there are these options. You might happen to go to the hospital and they probably don't mention all these options. That you have options of doing, let me make it clear, you have options of doing dialysis at home or doing dialysis at a clinic. And for those people, especially if you, that person who just happened to, you have retired, on your bucket list, you wanted to travel to all these different countries, and you are like, I'm gonna cruise 3 months, I'll go to Italy the next month, I'll go this place the next month I'm going to visit my grandchildren in California or wherever they are. Then you have to say, hey, ask your doctor, which is the best treatment options for me? And to me, if you come to me, I'll say, hey, you can do peritoneal dialysis, because that one you can do anywhere. You can do it anywhere. You can do it at home. You can do it you know, even when you can do it even at work. For those people working, you can do it at work. If you're traveling, you can do it while you are traveling. It's the most convenient part of it, because the two dialysis option, the two peritoneal dialysis, you have the one that is manual. You put the dialysis, it dwells, and then you drain it. Then there's where you do a cycle, where it's a machine and the machine is doing the whole thing. You just connect yourself and you set up the machine, and the machine do all those cycles for you. So that you can do it anywhere, as long as you maintain the cleanliness that needs to be done. Then you still can do hemo at home, or hemodialysis. This is a small machine, you do it at home, and it's, you know, you put the needs or you use the catheter. That one, you still can do it. There's a capability of traveling with it. So if you're that person living that kind of lifestyle, your job requires you to travel, you are retired and you travel, you can be able to do those type of dialysis at home, and that will be the best option for you. Let's think about it. Say you live in those countries where really one hospital to the other is way too far, and they're not, probably you have to do dialysis in a hospital setting. That's how that country is set. So what you have to talk to your doctor and ask, do I have other options of me being taught how to do dialysis at home? And you may be surprised that there are really those options for you to be able to do dialysis at home. And I think, to me, that will be the best options for people living in developing countries where they don't have enough resources, that the government should be able to cover and assist these people and pay for those treatments, to be able to do treatments at home. Because if somebody has to travel from the village to go to a hospital, and mind you, it's not a 2-hour drive, it's probably an overnight drive to go get dialysis, that person has to have, the person have to think about the bus fare, they have to think about where they will sleep, they have to think about their the person that they have gone with, you know, the meals and all those things. Is costly. Of course, they are not even able to afford dialysis to begin with. So those options are there, and everybody and all the government should be looking at those resources, making sure, can we make it that people that they have access to this kind of treatment, and especially home dialysis. But there are instances that some people might not be able to do home dialysis. I'm not saying it works for everybody, not everybody. It could be because of your medical condition, you might not be able to do it at home. But you can do it at the clinic. And then in the clinic, there are two options. You can do it during the day. If, say, you don't work, you know, you can do it during the day. But if for that person who works, there's options of doing it at night, and it's called nocturnal dialysis, that you go there and have somebody to take care of you. And the instance that those ones will work, some people, I say, you probably have a hectic job schedule. You go to work, you have been up and down, you know, trying to go home and do dialysis might be so hard for you. So the options that you have is to go and do dialysis at in-center clinic or a hospital setting, for those clinics that have, for those countries that have dialysis connected to a hospital, and you do it at night. But until you ask, you never know. And until you hear about it, you never know that you have those options. That's why I'm here today to talk to you about the options that are out there. And I'll repeat again, you have dialysis that you can do at home. That's hemodialysis. That's still blood exchanging, going through the machine and coming out, getting cleaned and returned. Also, that one you do in your abdominal cavity. You can do it at home. You also can do hemodialysis. You can do during the day. You know, some places have 3 shifts. You know, you can come at 5, you can go there at 5 o'clock. Some places you go, you know, they give you a schedule of the time that you need to do it. But if you have also a busy schedule where you work, you have kids that you need to take care of, you can do it at in-center and do it in the evening or at night. And that's called nocturnal dialysis. So why am I emphasizing about these treatment options? Because and why am I coming here and talking about it? Because most of the time, most of people that I might be talking to is somebody who have been told that you need dialysis, and they just happen to go to YouTube and find out what is dialysis, and they don't know what are my choices out there. Most people, they're like, you're told you need dialysis, and some hospitals, they just said to you and say, go to a clinic. You have not been given the options that are out there. So watching this video gives you the option to see what is that fits me. How is my lifestyle? How can I work around dialysis? How can I do things around dialysis instead of dialysis working around my schedule? The other thing I would like to say, that once you sit with your doctor, ask your question, and I can go over the questions that you might have to ask. You might say you have to explore, are you employed full-time or part-time? Do you travel daily for work or for leisure? You are retired. Do you have been traveling and now you just want to feel like you're that person, you feel home is the best place to be, and you feel that's where you feel the best, like you feel empowered when you do it at home. Then you have to ask myself, which one will it be better for me? Will it be at home? That's where you feel peace of mind. Then those are things that will make you decide which dialysis, and probably the home dialysis will be the right option for you. Do you feel like you need control of your own treatment and your treatment and your life and your dialysis life and your own health? Then when you do it at home, that means you have control of that. You control your treatment. You control how you control your own care. You are the advocate. You care. You are empowered, and you're doing things for yourself. Then you want, if you feel that, say for instance, you feel more comfortable with people who are trained, of which even when you do it at home, you'll be trained. It's not just like you'll be told, go do it at home and you do not have training. You have all the support you need to do it at home. But if you feel that you're that person who cannot stick yourself, you hate looking at the blood, you faint, then I think the best option to go into a clinic setting where somebody will take care of you and help assist you with your treatment. You have trouble keeping up with things. You're busy. Your life is just hectic. You have young kids. You cannot be able to handle doing dialysis and taking care of your kids. Then that means you need to be in a setting. You do it during the day, or you can do it at night. You have parents, and I have seen it where you have you are taking care of your grandparents or your parents who are elderly. Then you cannot be able to take care of them and take care of yourself and give yourself the best treatment. So the best option, again, probably is going into a setting, or in doing it at night or during a day, or whichever times work within that time. You can find somebody else to take care of your parents. And do you want the flexibility? The one question, that flexibility, convenience, that you have your own schedule. You're that person who is stickler to their own schedule. You have a routine. This morning I wake up, I do this A, B, C, D. Then you're best suited to do it at home because you can make your own schedule. Are you socially active? Like, you have so many things that you do socially, in the community. Then at home might be the best time, or you can do it in center but do it at night. And are you young, healthy? The only problem that probably you have a kidney failure for whatever reason. Your kidneys have failed, but you are young and healthy. Then hey, home is the best. And I like to say, and people might throw stones to me, but this is how I look at it. And that's why I say for instance, you're young and you go to in-center, and majority of people you find they are elderly, they are older. Then you feel, and it's what we see on a daily basis reflects on how we feel about ourselves. If you keep looking at a dark spot in your room every day, I'm not saying that that's how it is, but whatever you see on a daily basis, if you see something, that's how you feel about it. You see patient, you feel, and you feel like this, you know, this, that a little bit of disconnection. You feel, okay, these are my grandparents, they are my grandfather, they're my grandparents, they are my parents, and you feel like you can't relate. That's something else. As a young person, do it at home. I'll do it at home. Do it at home, because that way you don't feel like you don't feel like you're out of place. They might talk things that you're like, oh God, I don't even know. Those things, you feel that you're out of place. So the best place to do it is at home. And I advocate for people. I feel home is the best. You get the best care because you feel empowered, and you take care of yourself, and you feel that you're living quality life. Nothing changes. It's just that you have dialysis, but nothing else is changing. Say you're that person who like being out there, and you feel being around people that have getting the same treatment, going through the same. That's your that's where you feel comforted. You feel you get your relief, then in center, either day or night, that might be the best fit for you. So now that I have triggered those questions that you should ask your doctor or your provider when you're choosing your treatment option. But don't be scared. Always be your own advocate. Always ask questions, and always ask for clarifications. Now that you have been told you need dialysis and you have to go to dialysis, and now you have started dialysis, you have to create your own plan. Or if you don't create your own plan, the healthcare provider will create a plan with you, and they'll tell you this is how, or you need dialysis so many days, how many hours, you need this and this, you need this medication, you need this and this and this. They'll tell you everything you need. But just because they have said that, you still have to advocate for yourself. You have to make sure you are staying up to date. If you're doing it at home and you set those labs, you have to find out, what are my labs? So how am I doing? How are my treatment looking? Because it's not just doing treatment. There's somebody out there looking at that information, looking at that data, looking at your treatments. How are you doing? How do we need to make any changes? So then ask, have you guys done any changes? Either at home, if you are at home, or you're doing it in the clinic, ask the care team, have you done any changes in my treatment? Is there something that I need to do? And always, every month, make sure you are asking. Even if you're not meeting with them on a monthly basis, always ask, are there any changes? Also, communicate. Communication is key. Until you tell somebody, nobody will know. So let your doctors, let your care team know everything that is happening in your life. Do you feel any changes in your life? Do you feel anything different from how you have been from yesterday, the day after, or 3 days? If you see anything different, always communicate. Always be your own advocate. I cannot emphasize that. And when you are own advocate, you feel empowered. You feel you own yourself, and you get the best care. You have to ask, you have to communicate, and you have to stay empowered. Even when you go to the clinic, if, say for instance, you do not do your own treatment at home, but you do it at the clinic settings, although you feel comfortable, because it's not because you're scared of blood or something else. If you're not scared of blood, tell somebody, hey, I need to know how to put a needle in my arm. I need to know how to connect myself. Can you show me? Understand even that machine. What do the numbers say? What is that machine? What is it? What are those things they're putting in there? If they come and they check your blood pressure, ask them, how is my blood pressure? Ask them, say, hey, let me look at the machine, see the numbers, understand. And in the next channel, we shall be talking about the words that you feel when you go to treatments, the things that you hear people talking about it. Be empowered. Go there, meet with people. Be part of those self-help groups, support groups, and be an advocate for others. There are people who might not be able to speak for themselves, but you can speak for them. And even in the government, you can speak for yourself and say, hey, these are the things that we need to be done. Because dialysis and ESRD and kidney disease is something that not everybody is speaking about it. Always talk about it. To add, I say, always make sure if you're doing treatment at home, always do as prescribed. If the doctor has said you need to do 4 times a week, make sure you're doing those 4 times a week. If your doctors have said you need to do 6 times a week, do those 6 times a week. There's a reason why your doctor has prescribed you those treatments. And if you go to in-center 3 times a week, make sure you go to your treatment as prescribed. Because think about it. Your kidney function 24/7. If you have a healthy kidney, it's functioning 24/7. But then that time you're doing your treatment, say you're doing 4 hours, and you have to multiply 4 hours. So 4 hours, so 4 hours, you have to see how many minutes. So can you imagine, you out of a day, out of 7 days a week, so your kidney, you have been assisted, or the dialysis has supported only 3 times a week. So that's for 24 hours a week, where your kidney work 24/7. So think about it. So that's why it's so important. Every single minute that you do that dialysis as prescribed, it counts. It matters. So not cutting it, making sure you're meeting it. If you can't make to that treatment that day, make sure you reschedule. If you do it at home, you always do it in the morning, and you did not make it to do in the morning because something happened, make sure you do it at night. You cannot miss, because that 1 minute matters. That 1 minute count. Every single minute that you are doing your treatment matters. Again, thank you for watching. Thank you for those people who have subscribed. Always give a thumbs up. I'm here to support you and your family, and to talk to you and say you can still live a thriving life no matter what. No matter being on dialysis, it's challenging, it's scary, it's worrying. Yes, but you still can live a thriving life. You can take care of yourself and live a good life. So give some thumbs up, subscribe, and remember, 1 out of 3 people are risk for kidney failure, and millions of people are living with kidney failure and they don't know. It's through this channel and the other channels out there that when you watch it and let somebody else watch and talk about it, then we can be able to get better, live a thriving life. And if you're not on dialysis, you can prevent yourself from going into dialysis by making sure you're watching controlling your diabetes, controlling your high blood pressure, and making sure you're eating right. Thanks again, and keep watching. I really thank you for taking time to watch.